The thyroid is a small organ located just below the voice box. Many people rarely think about it, yet it controls some of the most important functions in the human body. It influences how quickly we use energy, how we feel, how our heart beats, and how our metabolism works. When the thyroid is healthy, we hardly notice it. But once it becomes unbalanced, daily life can change dramatically. An underactive thyroid slows the body down. People feel tired, low in energy, and more sensitive to cold. Weight gain, difficulty concentrating, and low mood can also appear. These symptoms often develop gradually, which is why many do not recognize them at first. With an overactive thyroid, the body runs too fast. The heart beats quicker, inner restlessness increases, sweating becomes more frequent, and weight loss can occur even with normal eating habits. Some people experience trembling, sleep problems, and strong nervousness. These signs are often mistaken for other conditions because they are so varied. The thyroid is sensitive to stress, hormones, and nutrients such as iodine. That is why early detection is so important. A simple blood test can show whether hormone levels are balanced. When treated in time, most thyroid disorders can be managed very well. In this film, we explore how the thyroid works, which warning signs should not be ignored, and why even small changes can have major effects on the body. Many people do not realize how sensitive the thyroid is to external influences. Stress, diet, hormones, and even certain medications can affect its function. One of the most important factors is iodine. The thyroid needs iodine to produce hormones, but while some people consume too little, others react very sensitively to it. Even small amounts can trigger symptoms. This is why it is essential to pay attention to your body and take changes seriously. Common warning signs of thyroid disorders include fatigue, weight changes, rapid heartbeat, nervousness, or a feeling of pressure in the neck. However, many of these symptoms are often attributed to other causes such as stress, lack of sleep, or aging. As a result, thyroid problems can remain undetected for a long time. Early diagnosis, however, can prevent many complications. The mind also plays an important role. An underactive thyroid can worsen low mood or depressive feelings, while an overactive thyroid may cause restlessness and anxiety. Many people are unaware of these connections. That is why it is important to consider both physical and emotional symptoms together. In this part of the film, we explain how the thyroid interacts with other organs, why hormones are so crucial, and which warning signs should not be ignored. The earlier we understand what is happening inside the body, the better a thyroid disorder can be managed. The thyroid does not work alone. It is part of a complex network of hormones, organs, and feedback mechanisms that regulate the entire metabolism. A key player in this system is the pituitary gland, a small structure in the brain. It constantly monitors the level of thyroid hormones in the blood and instructs the thyroid to produce more or less. This interaction keeps the body in balance. When this system becomes disrupted, the effects can be far-reaching. An underactive thyroid slows the body down. Everything becomes slower: the heartbeat, digestion, and concentration. Many people describe the feeling as moving through fog. With an overactive thyroid, the opposite happens. The body runs too fast, the heart races, the hands tremble, and even simple tasks can feel exhausting. Some people lose weight despite eating normally. Changes in the neck area can also occur. An enlarged thyroid, known as a goiter, often develops due to iodine deficiency or hormonal imbalances. Many notice a pressure when swallowing or a slight tightness in the throat. Such changes should always be checked by a doctor, as they may indicate an overactive or underactive thyroid. In this part of the film, we show how closely the thyroid is connected to the brain, the heart, and the metabolic system. We explain why small hormonal shifts can have major effects and why regular check-ups are essential to prevent long-term complications. Many people underestimate how strongly the thyroid affects the entire body. It not only regulates metabolism but also influences the heart, circulation, digestion, muscles, and even mental well-being. When the thyroid becomes unbalanced, the body often tries to compensate. But this compensation does not always work, and symptoms appear that seem unrelated at first glance. One example is the heartbeat. With an overactive thyroid, the heart beats faster and sometimes irregularly. Some people feel a strong pounding in the chest or an inner trembling. With an underactive thyroid, the heartbeat slows down, and many experience constant fatigue or exhaustion. Digestion also changes. It may speed up or slow down depending on the type of disorder. The thyroid also affects body temperature. People with an underactive thyroid often feel cold, even in warm environments. Those with an overactive thyroid may sweat easily, even with little effort. The skin can also change, becoming dry, sensitive, or more reactive to external influences. In this part of the film, we explain why the thyroid influences so many systems at once and why its hormones are essential for maintaining balance in the body. We show how disorders manifest and why it is important to take the body's signals seriously. The earlier we understand what is behind these symptoms, the better a thyroid condition can be managed. Sometimes it becomes clear how sensitive the thyroid and the entire body can react to certain substances, and how important it is for medical staff to be aware of these risks. People with a strong iodine hypersensitivity often experience severe reactions within seconds. The throat fills with mucus, breathing becomes difficult, the eyes begin to water, and the body tries to expel the substance immediately. Even tiny amounts, such as iodized salt or foods that are not fully cooked, can trigger these symptoms. The situation becomes especially dangerous when iodine-based contrast agents are used. These agents are common in heart and vascular examinations, but for people with a severe iodine allergy, they can be life-threatening. One real-life example shows how close such situations can be. During a planned heart examination, everything was already prepared. Only because the doctor double-checked the documents and asked a crucial question, it became clear that the required preventive medication had not been given. The procedure was stopped immediately, a decision that may have saved a life. Situations like this highlight how important it is for patients to know their allergies, take them seriously, and communicate them clearly. And this is where modern AI comes in. In many hospitals, digital systems now support the documentation of allergies and risks. They automatically warn staff if a medication or contrast agent could be dangerous. AI helps prevent mistakes, retrieve information faster, and detect critical situations early. This creates an additional layer of safety, especially for people who react strongly to certain substances. The thyroid is small, yet it affects nearly every part of the body. When it becomes unbalanced, we often feel the symptoms long before we understand the cause. That is why it is important to pay attention to warning signs and take changes seriously. Modern medicine and AI can help detect disorders early and better assess risks. If you have questions or notice symptoms, talk to your doctor. Thank you for watching. Feel free to subscribe and stay healthy.